The earliest years of a child's life are filled with rapid change.
Not only is this an important period of physical growth, but it's also a critical period of mental and behavioral development.
Here at PolicyLab, we are researching the challenges families may face with behavioral health during the first years of a child's life.
We're exploring themes of identification, of access, and of equity.
By learning more about these challenges, we're identifying solutions that can help ensure all youth can be their healthiest selves.
Our goal is to meet families where they are. This work is happening across primary care in partnership with child care facilities, with caregivers and families in their homes and beyond.
For example,
babies don't come with instruction manuals, and understanding the mental and behavioral health needs of very young children can be particularly difficult. It's also important to acknowledge that caregivers' mental health impacts children too. Pediatric primary care is a key setting that can provide information and support to families during early childhood. Within primary care, one program to support families is Healthy Steps. Healthy Steps is an intergenerational model that includes universal screening to identify families in need of additional mental health support. For families with identified needs, a Healthy Steps specialist can help parents with strategies to foster the relationship with their child, including support for their child's mental health and emotional well-being. If caregivers need support for their own mental health, the Healthy Steps specialist can provide that too. Our team will be evaluating the Healthy Steps program to understand it in the context of our unique health system and within Philadelphia, and explore sustainability of programs like this. Our hope is that including a Healthy Steps specialist within primary care will build the care team's capacity as we work with families to identify needs, facilitate access to resources, and ultimately promote healthy physical and emotional development among children.
Many of us don't recognize the importance of the first 5 years of life or how early caregiver experiences can impact a young child's behavioral health. My study, Prenatal to Preschool, is attempting to better understand the experiences of women who were pregnant at the beginning of the pandemic, and how those experiences may have impacted not only their peripartum period, but also their children and families. We're also hoping to understand differential experiences from the pandemic secondary to existing structural racism. We think it's important to understand all of the contexts in which young children are being raised. We are hoping to add to the conversation that young children have specific behavioral health and emotional needs. We hope that this research shines a spotlight on the experiences of women and children during the pandemic, and that we at PolicyLab can further our efforts to ensuring equitable care for all.
behavior challenges like tantrums are common and developmentally appropriate for toddlers and preschoolers. For most, these behaviors decrease over time. However, for some children, these behavior challenges increase in frequency and intensity and come to interfere with activities at home and in childcare. Both the pediatrician's office and childcare settings offer opportunities to discuss behaviors with caregivers. These conversations can lead to connecting families to services that can support their child. However, accessing those supports can be challenging. Our team is exploring how a navigator can empower parents throughout this process of setting up early intervention services. Through this research, we hope to find strategies to connect families to early intervention or behavior counseling and support young children's emotional regulation, readiness for kindergarten, and positive mental health throughout their lives.
Sleep and mental health are closely linked. Up to 30% of young children get less sleep than recommended for their age, while at least 20% have a sleep problem, such as bedtime tantrums or difficulty falling asleep. Many young children also show signs of sleep-disordered breathing, which can range from snoring to its most severe form, obstructive sleep apnea syndrome. All of these sleep problems are associated with poor attention, emotional and behavioral regulation challenges, and irritability in young children. Maintaining healthy sleep can be especially difficult during early childhood because there is so much growth and development during this time. There are also many changes in a young child's life that can impact sleep, such as starting daycare or preschool. At the same time, even having a consistent bedtime routine as many nights as possible could benefit their sleep and their mental health. My research investigates modifiable child, family, school, neighborhood, and broader sociocultural factors that contribute to sleep problems and sleep health disparities in early childhood. I conduct research in partnership with families, community organizations, and primary care clinicians on ways to improve childhood sleep problems. The overall goal of my work is to promote sleep health to benefit long-term child well-being and prevent mental health problems.
Behavioral health issues can profoundly impact the overall health and well-being of youth and their families.
Alongside our partners across Children's Hospital of Philadelphia, our research aims to identify evidence-based prevention and treatment opportunities to help families navigate challenges and support positive mental health from a child's earliest days.